Do you know what's the largest organ of the human body? It's your skin. Whether you're dealing with adult acne or looking for ways to soothe eczema and psoriasis, we've got you covered. Dr. Madeline Camejo, Chief Pharmacy Officer for Baptist Health, and Dr. Sheena Perkins, Clinical Ambulatory Pharmacist at Baptist Health, are the doctors on call today, and they're ready to answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, everyone. I'm Olga Villaverde, and welcome to Ask the Doc. No appointment needed here, the show where we encourage our viewers to send in their questions. And we're going to kick off with a question on acne. This one comes from allhealthtv.com, and Amanda has written the following. Thank you, Amanda. Hey, doctors, I'm someone who had a mild case of acne when I was in my teens. Now, I'm a 48-year-old woman who's not only going through menopause, but adult onset acne as well. So what's the deal with this? Dr. Camejo, how can we help her out?
Well, Olga, thank you for that. Hi, Amanda. Sorry you're having such a rough time of it, but I appreciate you sharing your story with us. So while acne does occur in our teens, and in some instances it occurs early stages of menopause, it's rare, but during menopause, there is an increase in hormones, which increases in oil production, which may lead to acne. So acne after menopause may be rare, but if you continue to experience it, you should go see your doctor. It will likely go away without treatment. However, reducing stress and have an active lifestyle may also help control the acne.
Fantastic. Thank you so much. Next question is coming in, and it's from Clay. Clay asks the following. Dr. Camejo, hi. I guess you can consider me a jock, as I'm lettering in 3 sports at school. Unfortunately, when you share a locker room with a bunch of other guys, you're eventually going to get athlete's foot. Is it true that athlete's foot and jock itch are caused by a fungus? And if so, what's the best way to get rid of it? I know a lot of people that go through this, Dr. Camejo, and sometimes struggle with it, and they're so embarrassed because they don't even know how to deal with it. So let's help Clay out.
Sure, and thank Clay for reaching out, but I'm going to let Dr. Perkins, who will be much happier to answer your question.
Well, Clay, it's true. Athlete's foot and jock itch are common infections, and they are caused by the same fungal infection, but in different body parts often. There are precautions you can take to prevent these fungal infections, like wearing shower shoes when you're with your teammates, and wearing socks and shoes, and not sharing towels with anyone that may be infected. The athlete's foot can spread by touching and scratching other areas, including your groin, causing the jock itch. Fungal infections do not clear up without treatment. Antifungal creams, powders, and sprays are available over the counter, but for example, clotrimazole, miconazole cream, and you must use it for 2 weeks. If it doesn't clear up in 2 weeks with over-the-counter treatment, then I recommend you see your doctor.
And Dr. Perkins, let me ask you this. If somebody is suffering from it, is it something that they will have permanently? Is this something that's genetic, or is it just transient, if you will?
It's not permanent. It's not, it is transient. It is transient to other persons. However, it is treatable. It is slow treatment. It must be treated consistently for 2 weeks.
Fantastic. Thank you so much, doctor. So we've got another question, allhealthtv.com, and this one comes from Fatima. This is what they write. Let's take a look. Hello, doctors. My darling grandmama is waiting for her Medicare to kick in. Unfortunately, she currently has a rash on her arms and torso. I'm pre-med, so I think it's either eczema or dermatitis. How can I tell the difference between them? And is there an over-the-counter medication I can buy to help get rid of it? All right, so Dr. Camejo, great question. Let's help grandmama.
And Olga, I agree, that is a great question. And Fatima, thanks for reaching out, and good luck with med school. But before I share my thoughts, let's check out this video from the Mayo Clinic.
Triggers for eczema can be internal and external, says Mayo Clinic's Dr. Dawn Davis.
Any sort of stressor to the mind, to the nerves, to the skin, or to the immune system can cause a flare of eczema.
It could be daily stress, a food allergy, or the jewelry you're wearing.
Some people with eczema are sensitive to nickel. They may be sensitive to a preservative in a medication that they're using.
Learning how to decrease your sensitivity or stress can help. She encourages patients to practice mind-body exercises, get plenty of rest, stay hydrated, avoid smoking, and practice a sensitive skincare routine. This includes daily baths or showers with mild soaps and frequent moisturizing with a fragrance-free, dye-free, and chemical-free lotion.
They may need prescription medicines. Those can be available topically by a cream or an ointment, or systemically by a pill or a shot. And then we may choose to do advanced therapy beyond that, such as patch testing.
For the Mayo Clinic News Network, I'm Dee Dee Stephen.
So as you can see, eczema and dermatitis are both generic terms for skin inflammation, and they're often used interchangeably. Now, dermatitis is broad and simply inflamed red skin, red, irritation, and swollen, usually resolved. Now, eczema is inflamed skin with other symptoms like severe itching, flaky, scaly, dry skin, and it's often long-term condition. Everyone with eczema has dermatitis, but not everyone with dermatitis has eczema. So if you're experiencing inflamed or irritated skin that is not responding to an over-the-counter treatment, then contact your dermatologist.
Thank you so much, Dr. Camejo. Great information. So in case you missed it the first time, here's a reminder on how you can send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, I love this next question, and I think this question is relatable to everyone. So this one comes in from Sylvester, and it's our first Instagram question of the day. So let's take a look, and this is a good one. Hello, doctors Camejo and Perkins. I'm a pretty healthy 38-year-old guy who just discovered an unsightly looking mole on the back of my neck. Actually, my girlfriend Juliet found it, and now she's nervous. It's skin cancer. As such, she's been doing research, and her diagnosis is either basal cell or melanoma. How can you tell the difference between a regular mole and a cancerous one? And how soon should I go to a dermatologist?
And Sylvester, great question. And I have some thoughts about this, but before I do, let's check out this video from the Mayo Clinic.
Both basal and squamous cell carcinoma, they're often slow-growing skin cancers. They're both caused most commonly by sun.
These cancers are predominantly found on sun-exposed areas, like the face, scalp, neck, and ears, says Mayo Clinic's Dr. Colin Costello.
For basal cells, they're often a pink bump that slowly enlarges with time. Sometimes they can bleed and be a little tender.
Squamous cell carcinoma may look like a skin-colored bump.
Sometimes they can get painful and ulcerate or kind of be almost like a non-healing wound.
Early diagnosis and treatment for these non-melanoma cancers are crucial. See a dermatologist if you notice spots changing or growing.
The majority of the time, both basal cell and squamous cell carcinoma are treated with Mohs surgery, particularly when it's on the face, scalp, and neck.
Reduce your risk and be sure to use sunscreen daily to help prevent exposure to dangerous ultraviolet rays. For the Mayo Clinic News Network, I'm Dee Dee Stephen.
So Dr. Camejo, I got to tell you, I love this question because I think it's so important to check moles, and I'm going to be personal here. My older daughter the other day was kind of noticing, and she said, "Mommy, what is this?" And it was like right here on her upper left breast. And it was a pretty visible mole. And she said, "Don't worry about it. It's not a big deal." And I said, "It's not a big deal, but let's check it out." And thankfully, they did a little biopsy and everything came back fine. But I think those things need to be checked. You just can't say no big deal and wonder.
No, I agree. And it was a great way that you also want to know the difference between a mole and a melanoma. It's really important. Moles are usually small, they're symmetrical, and they're usually flat. And they are common and usually harmless and not cancerous. But melanoma or skin cancer usually are asymmetric, half don't match, they're irregular, they have ragged borders. Sometimes they have different shades of brown and a varied coloration, usually larger than 6 millimeters. Now, like a size of a pencil eraser, and they're usually elevated. So not all moles are cancerous, but early detection is key to a successful treatment. And really, any concerns, don't hesitate to contact your doctor, just like you did, Olga, with your daughter, because it really is important to have them looked at early.
And Dr. Perkins, if you don't mind, I'm going to bring you in because, again, looking at those moles are so important. And if you could refresh our memory, I know there's kind of like an A, B, C, D that we should follow.
Yes, that's correct. So A is for asymmetrical, B is for the border, C is for the color, D is for the diameter, and E is for evolving.
And that's great information that people should look up. Again, just A, B, C, D, E. Have a lot of things that you can look for. And believe it or not, Dr. Perkins, that's what I did when I saw my daughter's mole. And regardless, I decided to go to the doctor at the end of the day.
Perfect, exactly.
All right, so I've got a YouTube question, and this one is from Corinne. Let's see what she writes. Bonjour, Dr. Camejo and Dr. Perkins. This is kind of embarrassing, but I've got a couple of warts on my hands. They're not very pleasant to look at, and I'm curious how I got them. I've heard two rumors about them that sound kind of crazy. They're caused by toads or by the HPV virus. Neither one is true, right? And how do I get rid of them? All right, Dr. Camejo, I'm going to put this one to you.
So Corinne, thanks for writing in and for watching the show. But Dr. Perkins, I think you got this one covered.
Yes. So Corinne, thank you. And I know, let's just clear up the old tales. It's a common myth that touching toads gives us warts, but it is true that it is caused by human papillomavirus, HPV. The toad myth isn't true because human papillomavirus is spread by humans and not by animals. And so the good news is warts are harmless and they often go away on their own. So you often don't have to treat them. But if it's bothersome, and I know sometimes they're hard to look at, there are some over-the-counter options available. Salicylic acid, it removes the layer of the wart slowly, and there's some freezing treatments. So if it's still bothersome and those over-the-counter treatments don't work, then be sure to contact your dermatologist. Also, most importantly, don't pick at them. Wash your hands and cover them to avoid the spreading and worsening of the warts.
Great information, and don't pick at them. Oh my gosh, that is something so difficult not to do, Dr. Perkins, but thank you for saying that. Interesting Facebook question here. This one is from Amani, and he wants to know the following. Hey, Doc, my wife, Maya, has developed a mild case of vitiligo on her forehead. It's not too noticeable, but it's really having an adverse effect on her psyche. Is there a cure for it, or is it at least something we can do to restore something of her color? It breaks my heart to see her suffering. Dr. Camejo, let's help here.
Yeah, Olga, you know, it's just, vitiligo is just not curable, yet there are some therapies that can help. And there are some doctors at Yale that are making great strides in a possible cure. Now, unfortunately, there is no magic cure to make it disappear, but bringing those cells back to life to help restore the color that doesn't match the, doesn't harm the body. Now, there are some ways to help restore some color with topical therapies to help reduce inflammation, encouraging some pigment return. Now, there's also light therapy that exposes the skin to ultraviolet light that can kind of stimulate the pigment and color production. Bleaching treatment to remove color if repigmentation is unsuccessful, so the white patches kind of blend together, making it less notable. But researchers are constantly working on the new treatments for vitiligo for better options in the future.
Thank you so much, Dr. Camejo. We're going to go back to Instagram, and we've got another question here from Aaron, I believe. So let's take a look at the question and see what they write. Hi, Docs Camejo and Perkins. My father has developed a case of what I think might be rosacea. His face gets easily flushed these days, and I think I'm seeing blood vessels or veins showing up on his nose. What can he do? Dr. Camejo, what are your thoughts on this one?
So Aaron, thanks for reaching out and sharing your story with us. It sounds like you're describing facial flushing, which can be symptoms of rosacea. So let's talk about it and clear up some misconceptions. You know, rosacea is a common skin condition that often causes redness, visible blood cells, and small bumps on the face. And it can make your skin feel sensitive or reactive. Now, it's important to understand that sometimes alcohol can be a trigger, while flare-ups for rosacea, but for some people, it doesn't mean that everyone with rosacea is drinking alcohol, and that drinking does cause the condition in the first place. So many people with rosaceas don't drink at all. So a lot of misconception on that is out there. But while we don't know exactly what causes rosacea, it is likely a combination of things like genetics, your immune system, and sometimes environmental triggers. And alcohol can be a trigger, but also spicy foods, hot drinks, some exposure, stress, even skin products can also trigger rosacea. And treatment, while there is no cure, there's always ways to management. And some of it is lifestyle changes, avoiding your triggers that can help reduce flare-ups. Medications your doctors might prescribe, like gels or oral medications to help reduce the inflammation, and even laser therapy. So if you're concerned about facial flushing and you think you might have rosacea, it's best to see the dermatologist.
Great stuff. Thank you so much. So just a reminder to our viewers, if you've got questions, we've got answers. And in case you missed it the first couple of times, here is yet another chance to send in your questions. Take a look.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Speaking of allhealthtv.com, we've got a question from Sabrina. Thanks, Sabrina. And this is what she writes. Dr. Perkins, my cousin Cecily has psoriasis, which occasionally flares up. We've recently noticed that our 12-year-old daughter, Penny, has been scratching her scalp and had a couple of scaly red patches on her arms. Is psoriasis hereditary? And assuming that's the case with Penny, what can we do for her? Great question. And I think a lot of people can relate to this.
Yes, they can. So right again, Sabrina, we appreciate you reaching out and sharing this with us. We don't know exactly what causes psoriasis, and we can't quite cure it yet, but there are some things that can be done to alleviate the symptoms. And it's understandably that you're concerned about your daughter. So psoriasis is often hereditary, but it doesn't mean that it can't be passed down to families through genes. However, it's important to know that those genes doesn't mean that she's guaranteed to get psoriasis. It's a higher chance, but it may develop later in life. So here's what we do know. We do know it's hereditary, that it's often hereditary. There's an increased risk of the child, about a 10% chance that she may develop it, and she may not develop it at all. There are some environmental factors such as stress, injury, infections that can trigger psoriasis in people that are pre-genetically disposed. So if she is diagnosed with psoriasis, it's important that it is manageable, to know that, and that there are effective treatments available. Early diagnosis and treatment can prevent it from becoming severe and improve her quality of life.
Thanks so much, Dr. Perkins. We're going to move on to Babette, who reached out to us on Facebook. And this is what she writes. Hi, Dr. Camejo and Dr. Perkins. I'm a woman in her mid-30s who spent a lot of time tanning when I was younger. So did I. Now I religiously check my body for any moles that suddenly appear. I guess my question is, does skin cancer only appear as moles? What a great question, Dr. Camejo. And then I have a question, if you don't mind, when we're done with this, that I want to ask about when I was young and I put, baby oil all over my body, but let's stick to Babette first.
So, Olga, that is a great question. And kudos to Babette for reaching out to us. Now, it is great that you're religiously checking your body and taking an interest in your health. And you have a right to wonder if it will always show up as moles, especially since you enjoyed tanning in the past. So tanning does increase your risk, whether it's outdoors or in tanning beds, exposes your skin to harmful UV radiation, which damages your skin's DNA, and it does increase your risk of all types of skin cancers. Now, skin cancers can often appear as changing in an existing mole or a new mole that might look suspicious. It's not the only way it can show up. Now, think of your skin like a map, right? So skin cancer can appear on any part of this map, not just where the mole mountains are. And here are some other ways skin cancers might appear, like rough patches. These might be red, scaly, or brown. They might feel rough to the touch. Sores that just don't heal and are always bleed easily. Growths, these may be raised bumps that are pearly or waxy, or they might be pink or red or even flesh colored. And spots, these might be flat, or raised, they might have a difference in colors like brown, black, tan, or even white. So it's important to be aware of all the different ways skin cancers can appear, not just moles. So regular skin checkups are important. Continue to check your skin regularly from head to toe for any changes, and look for anything new, changing, or unusual, and immediately see your dermatologist. If you see anything that concerns you, don't hesitate. Go see the dermatologist. They can examine your skin and determine if there's something to worry about. And remember, early detection is really the key to all of this.
Thank you so much, Doctor. Dr. Perkins, let me just bring you in a second, because she obviously talked about, tanning religiously when she was younger, and so did I. And way back when, 40 years ago, we really didn't have this amazing awareness today about sunscreen. So let's just go over the importance of sunscreen. A lot of people wonder sometimes, do I put 8, 20, 30, 70? If we could talk about the numbers and truly how it can save your life at the end of the day.
So wearing sunscreen is very important, especially if you're going to be in the sun at least for about 2 hours or more. The SPF recommended is to at least start with 30 and to avoid being directly in the sun. So those things are very important.
And if you get one that says 70 or 80, does that make a difference, or are you good with the 30?
It's good with the 30, but 70 or 80 is acceptable as well.
Of course. And then that baby oil, forget that.
No, it's not recommended at all.
No, it's not. All right, let's go to a Facebook question and Dorian, and she writes the following. Doctors, what role does UV exposure play in worsening conditions like vitiligo and rosacea? So ladies, let's start with Dr. Camejo.
So ultraviolet light can significantly impact skin conditions like vitiligo and rosacea, often worsening their symptoms. For vitiligo, UV exposure can be especially harmful for individuals. And this condition causes that loss of pigmentation that we had talked about it before, especially in patches of the skin, leaving these areas more vulnerable to UV radiation, because the melanin, which provides some natural protection, is absent. So UV exposure can definitely cause sunburn in those depigmented areas. Additionally, some studies suggest that UV exposure can trigger an immune response, potentially accelerating the spread of vitiligo. So, make sure you wear a hat, make sure you cover up when you're going outside. It's important. Now, rosacea, for people with rosacea, UV radiation is also a well-known trigger, and UV can lead to increased blood flow and dilation of the blood vessels, which worsens the redness and inflammation, which is characteristics of rosacea. So UV light may also lead to some skin damage and can cause some sensitivities and likelihood of flare-up. So many dermatologists recommend that individuals with rosacea use a broad spectrum sunscreen daily to protect UV induced irritation and inflammation. Olga, I know you wear a lot of makeup and foundation, and you always look beautiful. There's a lot of makeup today that for women that actually have the UV already in it. So if you're going to be out, you want to pretty yourself up, make sure that you use a foundation that already has that UV in it.
I do. And thank goodness for makeup, because without the makeup, it can be scary. All right, let's go to a question from Manny, and he wrote to us through allhealthtv.com. He writes, Dr. Perkins, are there dietary factors that can influence the severity of skin conditions like psoriasis or eczema? Good question there, Dr. Perkins.
Yes, so great questions. There's no one-size-fits-all answer, but diet can play an important role in influencing the conditions psoriasis and eczema. So for psoriasis, inflammatory foods like red meat, dairy, processed foods, and sugar can worsen psoriasis. Anti-inflammatory foods can focused on fruits, vegetables, can help and improve the symptoms. Also, gluten has been seen to link between psoriasis and the flare-ups. Also, with eczema, food allergies, for example, eggs, peanut, and soy, can be culprits of worsening eczema. And eliminating in your diet, working with your dietitian and your dermatologist, and keeping like a food journal to figure out what the triggers are and what your skin reacts to.
Fantastic. Dr. Perkins, we have about a couple minutes left, and I always love to include things when it comes to aging. And it's really just for me, if you don't mind, because I'm very transparent. I'm a 57-year-old woman who looks in the mirror and realizes that it's inevitable. But are there things that one can do besides, of course, the sunscreen? You hear about Botox, laser treatments. Your thoughts on laser treatments, stem cell therapies, Dr. Perkins? You know, I'm taking notes right now.
So laser treatment is not recommended in abundance. Anything within limitation, of course. Hydration is the most important thing. Lots of water, dietary modifications, and those are the key essentials in dermatology and in skincare.
Ladies, thank you so much for all the information, valuable information, and hope to see you next time on Ask the Doc. Appreciate your time. And that's all the time we have for today. I'm Olga Villaverde, and remember, this is Ask the Doc. Have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.